first, our own crisis. The way migrant workers, essential to our everyday lives, have been forced to risk their own. Heather Wright on the latest victims.
The province is racing to contain outbreaks among migrant workers at farms in southwestern Ontario, where hundreds are infected and 3 have died.
He doesn't see much change happening.
Through a translator, we spoke to a worker named Francisco today. We've hidden his identity as he fears speaking out will get him fired and deported. He says the living conditions at farms make it nearly impossible to contain the spread of the virus.
We have in rooms that are 3 meters by 3 meters, 4 people sleeping in beds that are in very poor condition, mattresses that are really used and spent, and in general, bedding that is in really bad condition.
Of the 257 new cases in Ontario, the Premier says most were on a single farm.
We went on one farm with 450 workers, and again, 175 tested positive.
Just last week, Ontario changed its public health guidance, allowing farm workers who test positive to continue working as long as they keep their distance, a way to get employers to cooperate with mass testing without the fear of losing their workforce.
This shows how Canadian provincial and federal authorities and the employers view migrants, not as people who need to be protected, who need to be sick, but ones who need to be forced to keep working.
Syed Hassan says workers aren't paid if they are sick. Many haven't been able to send money home to loved ones, and in some cases, access to Wi-Fi has been cut off. Because we don't have proper rights, they step on our necks, this worker says.
Piense, señor ministro.
Mr. Minister, she pleads, think about giving us a better life. The province is ramping up testing and inspections. Meanwhile, healthcare workers are being sent to the hardest hit farms. Lisa.
Okay, Heather, on the threat to migrant workers.